So 12:03, and let's get started. First of all, welcome everyone. I'd like to first acknowledge the traditional owners of the land on which we are meeting. I pay my respects to their elders, past and present, and the Aboriginal elders of their communities who may be here today. So good afternoon, everyone. Thank you for joining this month's webinar titled Safer Indoor Air from Science to Policy, which has been organized by the Center for Safe Air. So the center is an NHMRC Center of Research Excellence led by Professor Faye Johnston here at the Menzies Institute for Medical Research at the University of Tasmania. And we bring together researchers from around Australia with a focus on air quality and health. Our vision is for a healthier community through cleaner air underpinned by evidence-informed policy and practice. And just for those who are not aware, all of our webinars are recorded and available at the center's website. So my name is Nicolás Borchers Arriagada. I'm a postdoctoral research fellow here at the center, and I'll be chairing today's webinar. Improving indoor air quality is one of the best ways to improve public health and reduce the health burden associated with infectious diseases, asthma, and a range of other health conditions. While we spend nearly 90% of our time indoors, indoor air quality is largely unregulated and is subject to pollution from a range of indoor and outdoor sources. Today, we are privileged to have two esteemed speakers, distinguished Professor Lidia Morawska and Angela Cartwright, who will shed light on indoor air quality as it relates to public buildings and in our homes. Each speaker will present for up to 20 minutes, followed by a Q&A at the end. So please drop your questions and comments in the Q&A section below. Our first speaker is Professor Lidia Morawska. Lidia is a distinguished professor at the Queensland University of Technology in Brisbane, Australia. She's the director of the International Laboratory for Air Quality and Health at QUT, which is a collaborating center of the World Health Organization on research and training in the field of air quality and health. And she's also the center director for the ARC Training Center for Advanced Building Systems Against Airborne Infection Transmission, THRIVE, hosted at QUT. Lidia also holds the positions of Vice Chancellor Fellow, Global Center for Clean Air Research from the University of Surrey at UK, and is an adjunct professor of the Institute for Environmental and Climate Research, Jinan University in Guangzhou, China. She conducts fundamental and applied research in the interdisciplinary field of air quality and its impact on human health and the environment, with a specific focus on science of airborne particulate matter. She's a physicist and received her doctorate at the Jagiellonian University in Krakow, Poland. She's an author of more than 1,000 journal papers, book chapters, and refereed conference papers. Lidia has been involved at the executive level with a number of relevant national and international professional bodies, is a member of the American Academy of Arts and Sciences, a fellow of the Australian Academy of Sciences, and is acting as an advisor to the WHO. She's recipient of numerous scientific awards. Today, Lidia will discuss indoor air quality for public buildings. We are very glad to have you here today, Lidia. Over to you. Would you like to share your screen, please?
Thank you very much, Nick. Good afternoon. And yes, I'll share my screen. Hope you can see it in the presentation mode.
Yes, that's perfect.
Yes.
Thank you.
All right. This out of the way. Well, thank you again for inviting me to give this presentation, for your kind words. And as the title says, I'll be talking about science and the policy. So in my presentation, I'll start a little bit from policy, then go to science, and we'll end with policy. But both this aspect, science and policy, will be kind of intertwined in my presentation. I don't think that I have to stress in this group what are the pillars of public health and what are the issues with the policies of them are. Well, if we think about water, clean water, when we think, or rather we don't have to think about the quality of water we drink. We just get a glass of water from the tap and we don't have to think about it. It is regulated. The same goes for food. when we go to a supermarket, we don't have to think about the quality of the food. We don't have to check whether it's safe, fresh. It is regulated. Now, to an extent, this goes also for outdoor air. We don't have to think about quality about outdoor air. It is regulated. It doesn't mean that it is always clean. Like, for example, now in Brisbane, for the last few days, we have horrible quality of the air because of controlled burning, but still air is regulated, outdoor air. But what about indoor air? When this little boy opens the door to the classroom, who controls the quality of indoor air in which we spend most of time and inhale this air, well, 12 times a minute? Air quality standards. Now, if we compare outdoor and indoor air quality standards, in relation to outdoor air, we have two types of regulations: emission standards and air quality standards, with, as we know, many over 200 monitoring stations across Australia. One would say if all the emission sources perform according to the standards, meet the standards, well, why do we need air quality standards as well? Still, we do. But when we consider indoor air, we have national construction codes. But anything else? Do we have performance standards? We don't, which means there's no monitoring whatsoever of indoor air quality. We can ask this question from several angles. Well, why to measure indoor air quality? We could say to comply with indoor air quality regulations, but we don't have regulations, so we don't measure, we don't have to measure. But why do we need these regulations? Now, again, as I just stated, outdoor air is regulated there, and there's very importantly, there's a body responsible for this at national level, national environmental protection measures. But for indoor air, there's only construction codes, and the construction codes has nothing to do with performance. Well, some say, well, why do we need these regulations? Why it can be dealt by voluntary approach? And that conversation has been going for quite a long time. Well, buildings which have good indoor air quality, presumably, they will be more attractive. The reality is it doesn't work this well, and it doesn't because of the initial costs. Well, are these costs so big? Any cost benefits of achieving good indoor air quality show that there are huge benefits. So if we compare, and here I'm talking about new buildings, at least 1 to 10, so $1 spent at the initial state of a new building, it will give a saving of at least $10 in terms of reduced healthcare costs, infection transmission, absentees, and so on. At least some assessments are much higher than this. A lot of this work in terms of cost benefit is going on right now. Existing building, retrofitting, well, this depends on the building. Some of the buildings, modern, mechanically ventilated buildings would probably already meet standards. Some would never meet, or the cost would be too high. Now, still, if we go back to this, what are these costs, why we need to do this? There was a study published in China at the end of last year on the burden of disease attributable to indoor air quality, based on which I was invited to write an article to Science Bulletin. So just some highlights of this. So first of all, if we look on the left-hand side, and indoor air pollutants, PM2.5, CO, and so on, and those bands going to the right-hand side to the health effects, and all kinds of health effects. If we look for, in particular for PM2.5, there are very wide bands because these effects are most significant and relate to all the health effects. And I'm not going to talk about this, but I'll just mention something, that the study also assessed the corresponding financial cost of exposure to indoor air quality. Now, the study was conducted in relation to residential houses, not public buildings. But what the study showed that it accounted for almost 3.5 almost of China's gross domestic product. It's a huge amount of money. Is it only like this in China? The study also compared the situation between other countries for which data were available or similar studies conducted. So on the left, we have comparison between China and the US. And we can see that, first of all, PM2.5 in both countries is the dominant pollutant, slightly different DALYs rates, attributable disability adjusted life years in countries. Other pollutants are in somewhat different order, but still the issue is there, like it is in the European countries, and the comparison was with these 4 European countries. Again, PM2.5 is the #1 in all of the countries. So the issues of indoor air are not restricted to one country. Now, difference between guidelines and standards, and what I'd say a reality check. We have air quality guidelines, and some may say, well, we have the guidelines, so fine, why do we still need to do anything about this? So what is the difference between guidelines and standards? So guidelines, any kind of recommendations or guidelines on the protection of human populations or receptors, adverse effects of air pollution. But the key point is that guidelines, like the WHO guidelines, are exclusively based on exposure-response relationship. So it's all about health, epidemiological studies, toxicological studies, environment-related studies. Its guidelines are based on health. But when we consider standards, an air quality standard is a level of pollution which is promulgated by a regulatory authority and adopted as enforceable. And here we have a whole other list of considerations. So effect-based level, that's from the previous slide, average in time measurement procedure, and so on. So the key terms here is promulgated, and measuring procedure must be part of this. So this reality check is, if we cannot measure, if there's no measurement procedure, we cannot have a standard. I'll come back to this issue a little bit later. So now we can say, all right, we already know how to do it, which is measure and regulate air quality in relation to outdoor. What's the difference between indoors and outdoors? Why can't we do it in the same way? Well, because of several reasons. First of all, every indoor space is different, so monitoring is necessary in every public indoor space. We don't have to do the same outdoors. We don't have to monitor at every corner. We have lots of tools that, based on monitoring stations, several of them, we can model, we can get an idea about air pollution in the rest of the city. So that's first. Second, we cannot use bulky and expensive monitors for every indoor space. We cannot roll in air monitoring station in every room. And there's also one aspect which is very different, namely the pathogens responsible for transmission of indoor airborne infections cannot yet be routinely monitored in real time. What does this mean? We can't monitor them, but this is a huge issue indoors, which means we need to use a proxy, which is, again, very different to what we do outdoors. Now, proposed indoor air quality regulations. When I talk about this topic to colleagues from different fields, a long list comes of what needs to be, should be regulated, what we should add to the list to take care of all air quality risk indoors. So I've mentioned infection transmission, but it's all the sources which we operate indoors, everything which comes from outdoors, potential dampness and mold, ensuring some thermal comfort. And all this should be taken into consideration at the building design site, HVAC, heating, ventilation, air quality design, building operation, and taking energy demand into consideration. Is it manageable then? How many pollutants should we monitor or include in the list of what should be regulated? In our recently published, well, 2 months ago published paper mandating indoor air quality for public buildings, we considered all these aspects. And what we proposed were these 3 pollutants and 1 parameter, PM2.5, CO2, CO ventilation. We also provide proposed levels and averaging time or set points. I'm not going to discuss the rationale which is presented in the paper for all these levels and averaging points. It was done in the way like this kind of either regulations and guidelines are developed. This is, however, not the most important really aspect of the paper, because I mean the values, because every jurisdiction may at the end decide to choose different values. The most important is the process, how it was derived. I'll just mention a few aspects. One aspect in relation to ventilation and some specific issues about PM2.5, and then I'll go a little bit more in the monitoring. Now, ventilation, there's been lots of discussion about ventilation. Is it really doing something, helping or not? Logically, well, if you remove the virus from the air, infection risk is decreased. But from the health side, there's been always a question, is it or it's not? This study was conducted in Italy from September 21 to 22 on the vertical axis incident cases and normalized. So the upper curve shows the incident cases in that region, Marquette region. The government of this region decided or agreed to feed over 300 classrooms out of over 10,000 classrooms with mechanical ventilation. All the other classrooms are naturally ventilated. So the top curve here shows the incident cases for the classrooms without mechanical ventilation. And of course, smaller number of cases for this with mechanical ventilation. They are smaller there. But the most important is this, comparing of this normalized situation. And you can see here that the cases with the classrooms for which had mechanical ventilation, which means had ventilation, had significantly lower number of cases and significantly lower because the axis is logarithmic. So that's also one of the reasons why that specific value came. Now, the other aspect is the issue of monitoring and the low-cost sensors, because as I said, we cannot roll in an air monitoring station into every room. The topic of low-cost sensors have been emerging for quite a long time, so this changing paradigm of air pollution monitoring. Some years ago with colleagues, we've published also a paper on sensors in relation to indoor monitoring, in which we concluded that the awareness and of indoor air quality risks and availability of appropriate regulations are lagging behind the technologies, which means technologies are there. Now, again, that issue, what sensors to choose? There are low-cost sensors for basically everything. When we got to this topic of low-cost sensors, low-cost monitors, we decided on this tool as robust enough to be used for this purpose. CO2 is another, but it is, well, it's a low-cost sensor, but actually every modern building has many of these sensors already. So it's in a way outside this discussion. Based on this, we then developed this koala monitors, which have been used widely. And for this, we used the low-cost sensors plant tower, and particularly focus on PM2.5 and alpha sense carbon monoxide. It worked. We used only PM2.5 data. So, well, PM2.5 data, the issue is it's not gravimetric. Come back to this in a second. So it worked. We've had a number of monitoring networks around Australia and outside. We demonstrated stability, durability, and so on. So over the years, we demonstrate that it is possible because these are essential qualities for using these monitors or sensors for compliance monitoring. So one can say that everything is great, but there are still some issues, and specifically in relation to particles. And I keep stressing the importance of particles. This is a report which I came across just yesterday, Health Effects Institute now assessing that air pollution is the second risk factor, but that air pollution means particulate matter, much more than anything else. So it is just to really stress. So we have good sensors, but PM 2.5 is extremely important. So what are the issues still existing? So the issue is what I highlighted a moment ago, that the existing health-based particle guidelines, WHO guidelines, and Australian and not only Australian standards are mass-based, but all optical particle detection are number-based. So what are we going to do about this? There are not going to be soon studies, epidemiological studies, to come up with exposure-response relationship in relation to particle number concentration. We are working on this, but it's still years ahead. So we have to find, I call it a scientific bridge between particle number concentrations monitored by sensors and gravimetric mass. So this is the focus of the work, that bridge, which is pragmatic such that it can be used for regulatory monitoring. Scientific challenge. Two, the issue of calibration. We know very well that calibration is a key aspect of using any instrumentation. We know how to do it in outdoor monitoring station, but if we have thousands, tens of thousands of those real cost sensors, we have to do it differently, because we are not going to have technicians calibrating each individual sensor separately. So it has to be a different and practical methods of doing this. Now, is it possible? One could say that in relation to outdoor air, this calibration of low-cost sensors has already been, well, progressed quite significantly. There are tens of thousands, the last count I say over 30,000, but it was already some time ago, purple air monitors, and they are used to support government monitoring programs. So in particular, that in relation to that fire protection, air now fire and smoke map. But outdoor air, doing this outdoor air, it's easier because those sensors can be calibrated against the sensor, the monitoring network, standard instrumentations and satellite data. So there are lots of ways of doing this. But with this, for indoor air, this will have to be done quite differently. So to finish, policy. Well, we are working on this. Last year, there was this Clean Air Forum, Indoor Air Forum. The organizers were shy to add indoor, but it was Indoor Air Forum. And some members of our center were part of this, as can be seen. There was last year also a parliamentary inquiry into long COVID, and into which a number of us put submissions. So this were recommendations of the government to establish a fund and so on. I won't read all of this, it's in the document. But the bottom line of lead the development of national indoor air quality standards for use in Australia. It is in the document. It's not that it's already happening, it's still a lot of work, but this term has also been used. Well, this year, we were not shy, or organizers were not shy to say that it's about indoor air, this session in the parliament in March this year. And as you can see, several members of our center present. They were probably more, but just didn't come in front of my camera. So we are working on policies. So in summary, indoor air quality standards are essential to support public health. To be enforceable, they were different from the outdoor air quality standard, and a viable framework for regulating indoor air quality already exists. Thank you very much. This is our goal, to make clean, healthy and indoor and outdoor air the norm. And I'm stressing our role of scientists is to be part of this. So we should be not only in science, but between science and policy. Thank you very much.
Thank you very much, Lydia. That was a great presentation. So there are a few questions in the chat, but we'll come back to them later after both presentations have ended. Our next speaker is Angela Cartwright. Angela manages policy at Asthma Australia, the national consumer peak body for people with asthma and their communities. She leads the organization's strategic policy development to address air quality, climate change, and housing issues that affect asthma. Angela has previously worked in the non-for-profit, government, and corporate sectors on health and consumer issues. She holds qualifications in public health, communications, international studies, and law. Today, Angela will discuss indoor air quality for homes. We are thrilled to have you join us here today. Angela, over to you. Would you like to share your screen, please?
Yeah, thanks, Nico. Just checking you can see my presentation.
Yeah, that's perfect.
Okay,
Thank you.
thank you. And thanks also to the Centre for Safe Air for the opportunity to present today. And just to start out, I'd like to thank all of your researchers for your work over many years, researching important issues around indoor air quality, and hopefully I won't be butchering your science today. I also wanted to acknowledge that I'm joining from UN country today on the beautiful and chilly New South Wales South Coast. My presentation is mainly focusing on housing, indoor air quality and health, and I want to acknowledge the particular significance for these issues on First Nations communities, and the links across to many years of dispossession and colonisation and racism that links into the ongoing impacts of those issues in First Nations communities. So in recognising the traditional owners of the country that I'm joining from and that you're all joining from here in Australia, I also want to recognise the resilience and tremendous knowledge that we can all learn from among our First Nations people. And to give a bit of an overview of my presentation, I'm going to talk mainly around, as I said, housing and indoor air quality. I'll start out with a short introduction to asthma and Asthma Australia for any of you who aren't familiar with us. And then I'll give a bit of an overview of some findings of a survey that we did in 2022 around common asthma triggers in Australian homes. And then kind of zooming out from there, I'm going to look more broadly at housing and asthma policy priorities, and identify some of the opportunities in the policy landscape. So starting with asthma, as many of you may know if you have asthma or if you're researching in the area, it's a common chronic respiratory condition. It affects around 2.8 million people in Australia. We know that both prevalence and burden of disease are increasing. And while this is really concerning, there's a huge opportunity for progress. And this is because we believe around 70% of deaths and, 80% of deaths and 80% of hospitalizations and 70% of deaths are potentially preventable. So when we're talking about asthma, we're talking about people who have sensitive airways that get inflamed and triggered by things that are in the air or in their lifestyle, in the environment around them. And these triggers can cause symptoms and flare-ups that lead to hospitalization and even death. We know that some of these triggers include airborne particles, gases, viruses, pollen and mold. They can also include things like exercise, mental health symptoms, but a lot of the triggers are found inside homes. And again, the causes of asthma include the known causes that increase the risk of developing asthma include some of these triggers, but it's an area of ongoing research. What we do know is that for most people, asthma can be well managed through a combination of taking regular preventive medication and, of course, avoiding any known triggers. And I guess that's where Asthma Australia's work comes in. So we are the leading national charity for people with asthma and their communities. Asthma Australia and the state-based foundations have been around for over 60 years. And our purpose is to help people to breathe better so they can live freely, which really kind of makes air quality a core issue for us. You can see on this slide, down at the very bottom, I've got a little snippet from our current strategic plan, which has the bold goal of avoiding halving avoidable hospitalizations by 2030. And we do that in 5 pillars, which I've listed here in the dot points. And what we're talking about today is mainly around that influencing systems change pillar, where we have 3 strategic policy priorities. Those are air quality, with a particular focus on bushfire smoke and wood heaters, housing, and climate change. And whilst these are 3 huge areas, we try to focus on the links across these areas in terms of policy development and advocating for systems change. And I guess why we're quite focused now on indoor air quality specifically in homes, we know that there are certain conditions in homes that can increase the risk of developing asthma and can also trigger symptoms and exacerbations in people with asthma. We feel that the importance of housing is only increasing with climate change, as it produces more hazards that require people, particularly those with asthma, to shelter inside their homes. We also know that homes can be a source of ambient air pollution and can contribute to climate change through poor energy efficiency and reliance on gas appliances, for example, or wood heaters. We also feel that these issues are compounded by the twin crises we're facing with housing and high cost of living. So homes are a critical setting for efforts to improve indoor air quality. As Lydia's already said, around 90% of our time is spent indoors, but this number is even higher for people who have some known inequities. So that includes people with chronic conditions, older people, and people with disabilities. It can be up to 100% of our time is spent indoors, and for those groups, it is often in the residential setting. So people can be exposed to airborne hazards in their homes from indoor sources, things like mold and gas, and also from the infiltration of outdoor pollutants. And this kind of complexity means that we need a range of strategies to reduce exposure to airborne hazards in the home. And what Asthma Australia is increasingly advocating for is a holistic approach to improving housing and health. And we've articulated this approach in our brand new housing and asthma policy position statement, which I'll come back to at the end. And I'll share the link as well for anyone who's interested. So we're going to go on a whistle-stop tour through the results of our Homes Health and Asthma Survey. Some of you might have heard my colleague Rose Bell present on this before, and there's a fantastic report on our website which has more detail, and I'll share that link as well. Essentially, this survey was conducted in 2029 because we wanted to really understand what triggers people were exposed to in their home, what action they were taking to reduce their exposure to these triggers, and whether there were any barriers preventing them from taking action. So we looked specifically at indoor air pollution from heating with gas or wood heaters, indoor air pollution from cooking, including from gas cooktops, mold and dampness, and pests, so things like mice, cockroaches, dust mites. These are sources of allergic reactions that can trigger asthma. So the survey was completed by 5,041 people. It was a largely representative sample. And as I said, it was conducted in June 2022, which is somewhat relevant when we come to the findings on mold. As well as acknowledging the work of Rose Bell, I also just wanted to acknowledge the contributions of Griffith University, who's one of their Master of Public Health placement students, assisted us with developing the questionnaire, and the Healthy Housing CRE, who provided support with the questionnaire and the analysis, particularly the logistic regression. We're going backwards now. So we've got 12 key findings. The first of the findings was really kind of our headline finding, which was, for us, we've interpreted this as many people are living in homes that are not going to be healthy if they have asthma, allergies, or are likely to develop these conditions. We found that 3 in 10 people with asthma or allergies reported their symptoms were worse after spending time in the home. Additionally, 1/4 of respondents were either not happy or unsure about the air quality in their home. We also found that many people were exposed to asthma triggers in their home. And you've got the list here, but quite shockingly, and again, potentially related to the time that we conducted the survey, 50% of respondents had experienced mold or dampness in their home in the previous 12 months. Now, June 2022, there had been a lot of rain and flooding, but as many of you would know around the country, that has not necessarily eased up since there have been more prolonged period of rain, storms and flooding. We found nearly half the respondents used a gas cooktop. A quite shocking 7% of people were using unflued gas heating and 13% using wood heating. 70% had had some sort of a pest in the previous 12 months. We also found that some population groups were more likely to be exposed to specifically pests, mold and unflued gas heating emissions. These groups included First Nations people, people with asthma and allergies, and people with children in the home. We also found that people living in social housing were more likely to report exposure to mold and pests. And again, this is concerning because this is intersecting with some of our known health and social inequities. We dedicated an entire finding to gas cooktops in homes with children. We found that these homes were 1.4 times more likely to have gas cooktops than homes without children. And this is really concerning given that gas cooktop emissions have been estimated to account for around 12% of the asthma burden in Australia. We did find that homeowners and higher income households were more likely to use wood heaters and gas cooktops, which was an interesting finding. They were 1.5 times as likely to report wood heating compared with lower income households. And that was comparable in homeowners, which was just interesting considering some of the received wisdom that we have in the debates around wood heaters. In terms of why people, we asked why people liked the type of cooktop they had. For gas cooktops, unsurprisingly, the reasons people gave were mostly around preferring to cook on this type of cooktop. I'm not sure who finds it easier to clean a gas cooktop than an induction cooktop, but quite a few people did in our survey. Perhaps unsurprisingly, but good to quantify this, not many people were saying that their preference for gas cooktops had anything to do with their health or the environment. That was 15 and 14% of people respectively who preferred gas cooktops. We also asked people about using what type of heating they would prefer to use, and we found that most people would prefer to have central heating or reverse cycle air conditioning, but cost was a particular barrier to them, as was renting the home, not owning the home. We also have to note here that cold is a significant trigger for asthma. And so what's really important is that people have a type of heating in their home that they can not only afford, but is efficient to heat their home and prevent symptoms. Key findings 8 and 9 related to the types of action that people were taking around respectively mold and pests. And we found that most people were taking some sort of action. And this was particularly so for people who reported greater exposure to these hazards. We found that nearly all respondents were taking regular action to reduce, prevent or avoid exposure to mold, and around 7 in 10 respondents had taken some action against pests in the previous 12 months. When it came to barriers, the top barriers were cost, lack of autonomy, and lack of awareness or knowledge across all the triggers. So we've got 3 slides here that have open text, some of the open text responses from the survey, which people really generously kind of shared their experiences with us. As you can see here, people were saying they weren't able to have a fan or an exhaust in the kitchen. Air purifier costs were too expensive. When it comes to lack of autonomy, what we see here are quotes from people living in both publicly and privately rented households with different kinds of concerns. One saying they can't get the owner to do anything, and the other saying they're not able to do anything. They have to get the permission and they can't get that. We also had an issue that came up among many of the participants that was lack of awareness or knowledge. So it was that real sense of, I didn't even know this was an issue, or I've only just found out, or even though I know it's an issue, I really don't know how to fix it myself. So the last 2 findings, certain population groups were more likely again to report barriers to taking action against 3 of our triggers, being mould, pests and emissions from gas appliances. The groups are listed here, and again we see this crossover with some of our groups for which we would want to see more empowerment to take action. It's again the same groups that are experiencing more exposure and the same groups that are more likely to report taking action. So we see this picture emerging where people have greater exposure, they're doing what they can, but they're facing barriers. We think this kind of makes it really clear that there are systemic and structural barriers that prevent, in particular, low-income households, renters, and people living in social housing from taking action. And the final finding was that people who owned their home and people without asthma were less likely to be concerned about exposure to these triggers. So I guess wrapping up the survey, the way that we've kind of looked at the results, it really confirmed to us that many Australians are exposed to asthma triggers in their homes. It was also clear that some groups were more likely to be exposed and more likely to be doing what they can, and that this really kind of highlighted the need for policy responses to improve the health of Australian homes that prioritise these population groups, particularly around mould and gas appliances and wood heaters. So from the survey findings, we developed what we were calling kind of policy implications in 5 areas. So subsidy schemes or investment for low-income households to improve housing conditions, incentives or programs for owners to improve the health of private rental homes, of course, investment in improving existing social housing stock and improving standards for new homes, alongside, of course, education programs to raise awareness. We've kind of taken those implications and adapted them in a number of submissions, but what we now have fresh off the virtual process finally is the Housing and Asthma Policy Position Statement. It's been a long time coming, but what we've tried to articulate in this statement is a holistic approach to a healthy home from an asthma perspective that we believe would, if implemented, lead to a whole range of health benefits. So what we've kind of looked at with this is 8 features to consider in improving the quality of an existing home or in standards for new homes. And I won't go through each one, but again, I'll share the link to the position statement. What we want to see is these considerations integrated with existing healthy housing principles and also considered in terms of climate change housing adaptation. So really having that locally responsive, place-based response that says what are the priorities of the local community and what are the most relevant and pressing climate change risks now and into the future. And we've kind of popped these features again into a matrix. It's the same features, but what we've tried to do here is set out the features against some of the potential benefits to try and give an indication of both the co-benefits of certain modifications, that's if you're reading down, and then reading across a more integrated approach to the benefits. So if the priority is to support thermal comfort, this is the range of modifications that might be helpful. And just to identify some of the policy opportunities, I think what we're really keen to do is to take this kind of matrix approach and any other considerations and really strengthen our articulation of saying we don't just want to see energy efficiency upgrades in isolation. So there's been concerns raised that, for example, increasing air tightness and insulation without looking at ventilation on demand is going to increase people's exposure to indoor air pollution and potentially increase temperatures in warmer weather. So we shouldn't just be sealing up everything and leaving people to it, but of course sealing gaps in windows is important for reducing infiltration of outdoor pollution. So kind of calling for this holistic approach. So some of the policy opportunities where we have and will continue to put this forward are the National Health and Climate Strategy, which is being implemented. And I've listed some of the actions under that strategy which are yet to be rolled out and we think are really key opportunities to argue for healthier indoor air quality in our homes and more broadly healthier homes. The National Adaptation Plan, which is being developed, it's based on the National Climate Risk Assessment, which identifies a series of areas, which means that the adaptation plan, at least based on the consultation paper, is quite segmented, which is kind of the opposite of what we want to see, which is that more kind of holistic health in our policies, climate in our policies approach. And then some of the further opportunities moving out from the climate, those particular national climate processes, a national housing and homelessness plan is being developed, which actually had quite a comprehensive issues paper that really recognised a lot of determinants of health. The national strategic framework for chronic conditions is currently being refreshed, and we were pleased to see that the consultation process included what appeared to be a broader focus on determinants of health, including housing. A couple of the consultations open currently around climate resilience in Victoria and minimum standards for rental properties really present good opportunities, not just for housing. The inquiry into climate resilience focuses on the built environment generally, and air quality should absolutely be a key, I guess, focus for that committee, and hopefully will come up in their report. And then we have just some general housing, there's some general policy processes around housing, which I think are good opportunities to influence change. So there is investment in new social housing, particularly through the Social Housing Accelerator. And then there are these kind of broader agendas around energy efficiency, emissions reduction, and cost of living, which again need to not just be looked at in isolation. We need to understand how we can use government investment to lead to broader benefits for health and well-being, and certainly avoid unintended consequences. And of course, there are budget processes constantly and a few big elections coming up over the next year. And so in my view, these are all opportunities to be advocating for evidence-based policy reforms to benefit health and well-being outcomes that relate to housing. Happy to take any questions, and again, happy to share the links to the survey and the position statement.
Thank you so much, Angela, and for sharing those valuable insights. So we still have about 10 minutes, a bit more. So we'll open the floor for any of the questions. I'm going to read them, and maybe the panelists can answer. So the first one is by David Hamilton. He says, I carry an ARANET 4 CO2 monitor around with me most of the time. Occasionally, I find myself in indoor spaces with excessive CO2 concentrations. I feel an obligation to report this finding to the owner or operator of the building if I know who they are, but never have done so. Does the Center for Safe Air have any recommended practice for this situation? For example, do you have template letters I could use, or perhaps a website where I can upload the data for my monitor together with the location and circumstances of the reading? So, well, from the part of the Center, we don't have this. I don't know if, Lidia, you have anything to comment on this question.
Well, I start that I also carry my, you can't see it properly, I also carry my ARANET all the time. And in any situation where the concentration exceeds what we recommend, I bring this very loudly to the attention of whoever are the host operators and so on, which normally react with some action, but results in some action. But of course, this is very bringing awareness and the issues. Now, the Center doesn't have something like this. There was some 2 years or 3 years ago, there was something like this, a network in, was it in New York, where there was a database and everybody could upload concentration that was in relation particularly to restaurants. I don't think it still exists. I think there were some issues, and there would be some issues. The issues would start, well, those people, those organizations where it was reported high wouldn't be happy. Whether they could take legal actions, I'm not sure. Whether they could challenge that was the sensor calibrated or not. So something like this should be done, should be done, but should be done in a carefully and proper way. Otherwise, as I said, they would create problems to those doing this. Having said that, that's a great idea, and something like this would and should be done.
Thank you, Lidia, for that. So we'll go to the maybe this quick one. If someone asks, where can you obtain one of those handheld monitors you just held up?
Well, we bought them online. This ARANET is the best, well-known, and I think it's the best for this purpose. Just Google it and you can buy it online.
Great, thank you. And then David
And
Peterson.
you will get then addicted. If you buy one and carry one with you, you will get addicted to this, and you will addict others, which is a good thing.
Okay, that's great. David Peterson is asking, does it make sense to have air quality standards for pollutants for which there is no safe exposure level or for which no safe exposure level is known? If so, how can we justify the risk of setting the standards for those pollutants above zero?
Well, there are 3 pollutants which we included in the proposed standards. Two of them are PM2.5 and CO, and we took the values directly from the WHO air quality guidelines, for which they exist exposure-response relationship. So, and the WHO guidelines clearly state that they apply to both indoor and outdoor air. There was one catch in relation to PM2.5, namely that there are 2 averaging times which the WHO guideline has, which is 24 hours and annual. Neither of this is applicable to the typical public spaces, and that's for public spaces. Exposure times are usually shorter. So as we explain in the paper, we applied what's recommended by the WHO guidelines for 24 hours, we applied to 1 hour. Now, for CO, we took the values directly from the WHO guidelines, and this was from the early edition to 2010. Now, for CO2 is clearly stated it's a proxy for ventilation and infection transmission. So it acts as a proxy. So for this, there are no exposure response curves. So in that sense, there are bases for all the pollutants and parameters included in the proposed standard.
Okay, great, thank you. Craig Darlington is asking where we could get a copy of the federal government report that Lidia referred to in her presentation. There's
a link provided in my slides, so if the slides are shared, that link is there. I haven't checked whether recently whether it works, but it should work because it works.
Yeah, thank you. What is your opinion on the proposed new indoor standard from Safe Air Australia for diesel particulate matter, DPM, in the form of elemental carbon? Have they considered PM2.5 or PM1?
Well, this is an interesting question. These are particulate matter. Now, if elemental carbon is controlled, well, this would take care of good fraction of PM2.5, PM1, PM2.5. But whether they should indeed also include PM2.5, and what are the reasons for including only elemental carbon, I haven't had a chance, to be honest, to look into this. But elemental carbon is certainly a good step to start with.
Thank you. So we have 5 more minutes, so I'll just pop in the last question. This is for Angela. Angela, did you elaborate any research regarding the genetic asthma? And do you think that the target policy should be similar with the problems of general asthma?
I'm not sure what the second part of the question relates to, and I would take the first part on notice. That's very much one for my colleagues in our research team. Tilka, are you able to elaborate what you mean by the target policy?
Tilka, can you elaborate a little bit more?
While we wait, I saw there was a question from Jeff as well around government regulation. And Jeff, I think it's probably, we look less at government regulation. Like obviously minimum rental standards are important and the proposed improvements in Victoria are good, but they're not going to address a lot of the issues that we're concerned about here. So I think what we look at is where governments are spending money on homes. So energy efficiency upgrade schemes, rarely seem to look at using, for example, or requiring fans to be installed. They often don't look at replacing induction cooktops. They maintain wood heaters, housing adaptation investment. So local governments and state and territory schemes to kind of look at, a lot of them are looking at responses to extreme events, but they're not necessarily looking at slow onset or chronic climate change impacts. So we're advocating for not just considering how to make homes more resilient to damage and destruction, but also to make them more resilient for the occupants to those more chronic climate change impacts. But yeah, I think there's a broad range of processes. I'm happy to chat a bit further, but yeah, the list in the slides would be something.
Yeah, great. Thank you, Angela. So as we conclude today's webinar, I want to extend my sincere appreciation to Lidia and Angela for the excellent presentations on this topic. We hope the attendees have found this information valuable and insightful. Sorry we did not manage to get through all the questions, but we'll pass them on to the speakers and be in touch with you soon. So if you have any further questions or would like additional resources, please reach out. We look forward to seeing you at our next webinar, which will be on air pollution, children and schools, to be held on the 19th of July, 4 weeks from now. We will send out invites for this upcoming webinar soon, and thank you everyone and have a wonderful day. Goodbye.